Hi everybody, this is a video about die-off symptoms. Someone posted a question on one of my other videos asking what are die-off symptoms? It was a video about biofilm disruptors, and I would have mentioned something about microbes dying off and watching out for those types of symptoms. So good clarifying question. And I know patients ask me this question all the time when I'm working with them, saying, okay, we're going to start on some antimicrobial herbs going after SIBO or LIBO or persistent borreliosis or Bartonellosis or whatnot. So we talk about the die-off reactions to watch out for. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So when it comes to die-off symptoms, what exactly is happening there? So we've got these critters running around in the body, and we work with herbs, or some folks might use pharmaceuticals or might use other agents like silver or certain other nutraceuticals that might have an antimicrobial effect that are killing those microbes. And when microbes die, they don't just magically evaporate. That would be too easy. They die, and their cell walls or cell membranes, depending on whether they have cell walls or cell membranes or whatnot, they basically break open and release their innards. It's kind of gross to think about, but that's just the way it goes. And their innards are quite inflammatory. So the body, like the immune system, kind of gets a bee in its bonnet, so to speak, saying, oh my gosh, there's lipopolysaccharide floating around or other intracellular components that are going to trigger an inflammatory response in the body. And so hopefully there's enough healthy white blood cells kicking around, macrophages, things like that, to kind of gobble up the debris, kind of keep it sequestered and get rid of it, and digest it down in a nice efficient way and flush it out of the body nice and efficiently. Without these body parts triggering too much inflammation. But if the rate at which the microbes are being killed off exceeds the body's ability to kind of do damage control on mopping up those dead body parts, then the person's going to start experiencing inflammatory symptoms. They're going to feel worse. And so that's, to my understanding, the mechanism behind which a person would have a die-off reaction, also known as a Herxheimer reaction or a Jarisch-Herxheimer reaction, or a Herx for short. So the question is, okay, so what are the symptoms of a die-off reaction? So the way I describe it to my patients is a die-off reaction could cause an exacerbation of pre-existing symptoms. So if a person comes in saying, I've got joint pain, I've got fatigue, and I've got brain fog, those are my main symptoms. Well, a die-off reaction could cause any of those symptoms to get worse. So that's kind of a general mnemonic to remember what might a die-off reaction look like. But there can be more generalized die-off reaction symptoms, which the mnemonic for that I expressed to my patients is it's kind of like coming down with a flu, but you don't have a sore throat or a runny nose. So let's say there's a person who's I don't know, maybe they have their primary symptoms are headaches and sinus symptoms and maybe skin symptoms, for example, from say yeast overgrowth in their sinuses or something like that. So they don't have fatigue and brain fog and this and that in this scenario. Well, that person, if they're overdoing it on their nasal sinus yeast protocol, their die-off symptoms could look like, again, a flu without the runny nose or the sore throat. So they might feel tired, they might feel really kind of achy, they might feel sort of just heavy and kind of malaise-y and blah. They might develop headaches, or in this case, this example, the person already had headaches, so those might get worse. And then the person could also have some gastrointestinal upset, and that's usually more common if there's an antimicrobial protocol for gut microbes, so like a SIBO, LIBO protocol. So you might see diarrhea would be more common than constipation, but sometimes constipation is a side effect, more gas and bloating, that type of thing. So it'd be basically an irritation or exacerbation of pre-existing symptoms or flu-like symptoms without the sore throat or the runny nose. I mean, some folks could potentially have sore throat or a runny nose as a die-off symptom if they had pre-existing sinus issues, or maybe you're going after strep or something like that. But that's kind of the general mnemonic. So it doesn't feel good. Die-off symptoms are unpleasant, but that is kind of the gist of what to look out for. So the approach that I take in my practice is generally to start with a low dose of antimicrobials, gradually increase it, and then until we're up to gradually increase the dose as long as it's tolerated until the patient gets to the maximum therapeutic dose. If they start to feel worse because of a die-off reaction, then we lower the dose down, or maybe take a break from it for a little bit, wait for things to settle down, and then take another run at the protocol. So I hope that this answered the question. If anybody has any further questions about this topic or anything else, please post it in the comment section below, and I'll do my best to answer as soon as I can.